As part of his treatment for COVID-19, doctors are administering several drugs and therapeutics to the president. They include an antiviral drug, Remdesivir, the steroid, Dexamethasone, and an experimental antibody therapy. Not all of the medications have been approved by the FDA. For more on this, I want to bring in Dr. Matthew Heinz. He's a hospital physician who also previously worked for the Department of Health and Human Services for the Obama administration. Dr. Heinz, welcome. Thank you so much for being with us. Let's talk about the president's treatments. He's getting an aggressive regimen of medications, including Remdesivir. What are the potential side effects? And aren't these medications usually reserved for severely ill patients?
Yeah, that's actually it's an excellent point. The Remdesivir, when I heard the president was receiving that made me a bit more concerned, because the patients I start Remdesivir on tend to be ones who have at least a moderate level of illness, and they are getting worse over a couple of days, and they have they have obvious signs of a viral pneumonia, patchy infiltrates on their chest X-rays or on their CT scans, and so there's just a variety, and they're also requiring oxygen typically. So when I heard that they'd started Remdesivir, that's kind of where I was thinking. And then, of course, most of us don't have access to that mixture of monoclonal antibodies that I guess in some ways approximates the convalescent plasma that's experimental. So the cocktail medications present, it's pretty
right.
impressive.
Can you tell us a little bit more about that experimental antibody? As you said, it's not really available to the general public.
Right.
It's not yet approved by the FDA for treatment for COVID. Is that correct?
That is correct, and it is. I believe it's been studied in humans, and it does. The idea is that treating folks with less symptoms, more mild cases, could potentially, with the treatment of a combination of monoclonal antibodies, like in this experimental cocktail that the president received, could prevent the virus from causing more severe symptoms that could potentially put people into the hospital or ICU. But I believe only 270 or so, less than 300 people have actually received the medication, and therefore that certainly makes me a little bit concerned, because that was one of the first ones they tried on the president of the United States, which is, it's pretty high stakes.
Right, of course. And of course, the steroid is a little bit more common, correct? That's been used more commonly to treat COVID-19?
It is, and it's something that again, typically you look for signs of that the pneumonia, and you see typically people are having a low blood oxygen, requiring oxygenation supplementally before you would give that. So that's again something that I believe they started on Saturday, or at least that's when they told us about it. So that's looking at the experimental antibody cocktail, and then Remdesivir, Dexamethasone, a variety of other medications, the high fevers, the hospitalization, the low blood oxygen at least 2 times transiently. The treatment he's been getting doesn't seem to be consistent with some of what we're hearing, at least from his medical team, or at least from his personal physician, in terms of how great he's doing. Because when I have people on all of those medications that I can actually order, they're maybe not in the ICU, but they need to be hospitalized.
So when you hear this cocktail of medications that the president is currently on, are you doubtful that he will be released, to the White House today, as some are saying, or could these, medications be administered safely at the White House?
The medications, Remdesivir and Dexamethasone, they could certainly be administered safely at the White House. My concern is that with patients that I've seen, they can decompensate or have a very severe respiratory decline very quickly. And it's right around the 7th day of symptoms. And from what I can tell, it's kind of a little fuzzy with the timeline, but we're looking Wednesday to Wednesday, right? Or at least Thursday to Thursday. So I would be concerned, just given his age and multiple comorbidities and risk factors, and the fact that he's the president. I would personally recommend that he stay under close observation in hospital, at least through that 7th day of symptoms, which would be probably this Wednesday.
Right now, as we were discussing, these press briefings have been a little anemic in terms of information that we've been getting, and at the same time, we've been hearing about this cocktail. And as you said, we get little snippets of information that seem to suggest there have been moments where the president was not doing so well. What, as a physician, would you want to know about the president's condition right now?
Yeah, I think anemic is being very kind. I think that they've been invasive, and frankly, as a physician, I've been really offended, and I've been really surprised that they would try to use public health officials and physicians to do political spin. I think it's terrible. But what I would like to know, just to get a better idea of how our president's doing, is what do the CT scans show? Is there evidence of a viral pneumonia, that process going on in the lungs? What is his pulmonary status like? They're giving us some numbers. His blood oxygen is doing well. That's great. But I would also like to know some of the inflammatory markers. We check a whole host of different inflammatory markers for patients that have COVID-19 to kind of gauge how well they're responding to treatment or how serious their infection is. And of course, none of those numbers have been forthcoming. But really just being open, 100% transparent with the American people right now, because everybody's watching. The world, China, Russia, Iran, and this is a national security issue, and we cannot have misinformation and confusion, because if we do, people will start filling in the blanks and making it up, and that's truly dangerous.
And Dr. Heinz, there's been some criticism from the medical community about the outing that the president took in the motorcade, to sort of greet his supporters. Do you believe that he did put at risk those in the vehicle with him?
Oh, without question. And I don't know how many exactly were in there, but it pretty clearly, if you are within a couple of feet, especially in those kinds of protected vehicles, it's all self-contained in there. If you are within a few feet of someone in a vehicle for more than 15 minutes, I don't care, unless you have your own breathing supply, you are going to be breathing in a significant amount of the respiratory droplets that the president would be exhaling, and that, of course, is how the virus is transmitted. I believe at this time he's very likely still contagious, perhaps highly contagious, and those 2 or 3 Secret Service agents are going to need to go immediately into quarantine.
Well, we hope that they remain healthy. Dr. Matthew Heinz, thank you so much for joining us. We really appreciate it.
My pleasure.